Hello everyone, now let us discuss about 2023 coding guidelines for coronary therapeutic services and procedures. This topic comes under medicine chapter, subdivision cardiovascular. Coming to coronary therapeutic services and procedures, they come under the code range 92920 to 92944. Describe the percutaneous revascularization services performed for the occlusive disease of coronary vessels, which are major coronary arteries, coronary artery branches, or coronary artery bypass grafts. And these percutaneous coronary intervention, PCI, percutaneous coronary intervention codes, are built on progressive hierarchies with more intensive services inclusive of lesser intensive services. The PCI codes. PCI means percutaneous coronary intervention. Codes all include the work of accessing and selectively catheterizing the vessel. Vessel catheterization is included. Transversing the lesion, radiological supervision and interpretation directly related to the intervention performed. Closure of the arteriotomy when performed through the access sheet and imaging performed to document completion of the intervention in addition to the intervention performed. All these works are included in the PCI codes. Accessing and selecting the catheterization of vessel, transversing the lesion, radiological supervision and interpretation, closure of the arteriotomy through access sheet and imaging performed to document completion of the intervention in addition to the intervention performed. And these codes include angioplasty. It can be either balloon, cutting balloon, wired balloons, cryoplasty, and atherectomy. Angioplasty and atherectomy. Atherectomy can be directional, rotational or razor. And stunting. Example, balloon expandable, self-expanding, bare metal, drug eluting, covered. Each code in this family includes the balloon angioplasty. Each code includes angioplasty, whereas diagnostic coronary angiography may be reported separately under specific circumstances that we'll discuss in the next slide. And one more important point is percutaneous transluminal coronary lithotripsy may also be reported using 0715T in conjunction with 92920, 92924, 92928, 92933, 92937, 92941, 92943 and 92975 as appropriate. The diagnostic coronary angiography codes 93454 to 93461 and the injection procedure codes 93563 to 93564, they should not be coded with percutaneous coronary revascularization services to report. The first one is contrast injections, angiography, road mapping and or fluoroscopic guidance for the coronary intervention. Whenever contrast injections, angiography, road mapping and fluoroscopic guidance is done for coronary intervention, vessel measurement for the coronary intervention, post-coronary angioplasty, stent, atherectomy, angiography, as this work is captured in the percutaneous coronary revascularization service codes. Whenever these things are performed for coronary intervention, contrast injections, angiography, road mapping or fluoroscopic guidance or vessel measurement, we should not code the diagnostic coronary angiography codes and injection procedure codes along with percutaneous coronary revascularization services, because the percutaneous coronary revascularization services codes, they include this work. Now let us see the scenarios where diagnostic angiography performed at the time of coronary interventional procedure can be separately reportable. What are the cases when we can separately report diagnostic angiography? The first case is no prior catheter based coronary angiography study is available. So we don't have any coronary angiography study. In that case, and a full diagnostic study is performed and a decision to intervene, that is decision to surgery, is taken based upon this diagnostic angiography, then you can quote this separately. The second case is, the first case is no prior study available. Second case, a prior study is available, but there are certain scenarios. A study is available, but the patient condition with respect to the clinical indication has changed since the prior study. Second case, there is inadequate visualization of the anatomy and or pathology. Third case, there is a clinical change during the procedure that requires new evaluation outside the target area of intervention. Under these three cases, even though if a prior study is available, then also you can separately quote diagnostic angiography. And diagnostic coronary angiography performed at a separate session from an interventional procedure is as usual separately reportable. Coming to major coronary arteries. The major coronary arteries are the left main coronary artery, left anterior descending, left circumflex, right and rhamnus intermedius arteries. 5 arteries. Left main coronary artery, left anterior descending, left circumflex, right coronary artery and rhamnus intermedius arteries. Now let us see the level 2 HCPCS modifiers indicating the coronary artery for cardiac procedures. The first one is LC. It is appended to indicate left circumflex coronary artery. The next is LD. It is indicated for left anterior descending coronary artery. Next is LM for left main coronary artery. Next is RI for ramus intermedius coronary artery. Next is RC, right coronary artery. Now coming to coronary artery branches, up to 2 coronary artery branches of the left anterior descending, that they are diagonals, and left circumflex, which are marginal, and right coronary artery, they are posterior descending and posterior laterals. Up to 2 coronary branches, up to 2 coronary artery branches of each of these 3 arteries are recognized. The left main and ramus intermedius coronary arteries do not have recognized branches for reporting purpose. And all PCI performed in any segment, it can be proximal, mid or distal, of the coronary artery branch is reported with one code. This is important. It is performed in any segment, it is reported with one code. And PCI is reported for up to 2 branches of main coronary artery. Important point. PCI is reported for up to 2 branches of major coronary artery. Additional PCI in the third branch of the same major coronary artery is not separately reportable. It is only reportable up to 2 branches. Additional third branch is not separately reportable. This is very important point. Now coming to coronary artery bypass grafts. So each coronary artery bypass graft represents a coronary vessel. We must consider that each coronary artery bypass graft represents a coronary vessel. And a sequential bypass graft with more than one distal anastomoses represent only one graft. Sequential bypass graft with more than one distal anastomoses represent only one graft. And a branching bypass graft, for example Y graft, represent a coronary vessel for the main graft, and each branch of the main graft constitute an additional coronary vessel. And the PCI performed on major coronary arteries or coronary artery branches by the access through bypass graft is reported using the bypass graft codes only. This is important. The PCI performed on the major coronary arteries and the coronary artery branches by the access through bypass graft is reported using the bypass graft PCI codes only, not the native PCI codes. And all bypass graft PCI codes include the use of coronary artery embolic protection devices whenever performed. They include the use of coronary artery embolic devices. So they need not be coded separately when used. All the bypass graft PCI codes, they include the use of coronary artery embolic protection device. Now coming to coding the base codes. Only one base code. Base code means, in other words, you can consider it as a primary code. Only one base code for this family, from this family, may be reported for revascularization of major coronary artery and its recognized branches. And only one base code should be reported for revascularization of coronary artery bypass graft, its subtended coronary artery and recognized branches. Whenever the PCI is performed on the branches, they are coded with add-on codes. But only one base code must be coded. Only one base code must be coded to report the revascularization of major coronary artery and its recognized branches. It can be native or bypass. Next point, if one segment of a major coronary artery and its recognized branches is treated through the native circulation, and the treatment of another segment of the same vessel, for example, one segment means proximal, the other segment must be distal, and another segment of the same vessel requires access through a coronary artery bypass graft. An additional base code is reported to describe the intervention performed through the bypass graft. Because you have a separate base code for bypass graft and separate base code for native circulation, native coronary circulation. So, this is important point. If one segment of a major coronary artery and its recognized branches is treated through native circulation, for that we will use base code for native circulation. And the next, the treatment of another segment of the same vessel requires access through a coronary artery bypass graft. Here, we will use an additional base code to indicate the bypass graft. Now, here are a list of PCI base codes: 92920, 92924, 92928, 92933, 92937, 92941 and 92943. Here is the list of base codes for PCI and their respective description. 92920. It indicates percutaneous transluminal coronary angioplasty, single major coronary artery or branch. The next is 92924. It indicates percutaneous transluminal coronary atherectomy with coronary angioplasty when performed, single major coronary artery or branch. The next is 92928. This deals with percutaneous transcatheter placement of intracoronary stent with coronary angioplasty when performed. So all the codes, they include angioplasty, and each of them, they include a specific thing. The first code includes angioplasty. The next code includes atherectomy. The next code includes transcatheteral placement of intracoronary stent. The next code is 92933. Percutaneous transluminal coronary atherectomy with intracoronary stent with coronary angioplasty when performed. Here, coronary atherectomy on already with the presence of intracoronary stent. Then you must report 92933. The next is 92937. Percutaneous transluminal revascularization of or through the coronary artery bypass. So these are the base codes for bypass. Internal mammary, free, arterial or venous. Any combination of the intracoronary stent, atherectomy and angioplasty, including distal protection. We have discussed this also. Embolic protection devices, including distal protection when performed single vessel. The next code is 92941. Percutaneous transluminal revascularization of acute, total or subtotal occlusion during the acute myocardial infarction, coronary artery or coronary artery bypass stent. Any combination of the intracoronary stent, atherectomy and angioplasty, including the aspiration thrombectomy. This code also includes the aspiration thrombectomy when performed single vessel. The next code is 92943. Percutaneous transluminal revascularization of chronic total occlusion. This is acute, total or subtotal occlusion. The next code is chronic total occlusion. Occlusion means blockage. Coronary artery or coronary artery branch or coronary artery bypass graft. Any combination of intracoronary stent, atherectomy and angioplasty when performed single vessel. These are all the base codes and they have the respective add-on codes to indicate the additional vessels. Now, PCI base code that include the most intensive service provided for the target vessel should be reported. The PCI base code that include the most intensive service provided for the target vessel must be reported. And the hierarchy of these services is built on the intensity of service ranked from highest to lowest is highest preference is given for 92943 and 92941 and 92933 all are equal. Next, lower than 92933 is 92924. Still lower than that is 92937 and 92928 and 37. Both are equal. And finally, least preference or the lowest intensity service is 92920. Highest is 92943, lowest is 92920. The PCI performed during the same session in additional recognized branches of the target vessel should be reported using the applicable add-on codes that we have discussed earlier. The add-on codes are 92921, 92925, 92928, 92934, 92938, 92944 and follow the same principle in regard to reporting the most intensive service provided. The intensity of service is ranked from highest to lowest as highest is 92943. So similarly its add-on code 92944. 92944 is the add-on code for 92943. And next 92933. 92941 does not have any add-on codes. 92933 has add-on code. That is 92938. Sorry, 92934. Followed by 92925. This is the add-on for 92924. And finally 92929. This is the add-on for 92928. And the base code is 92920 and its respective add-on is 92931. One additional code here is 92938. This is an add-on for 92937. There is slight differences in the ranking of intensity. Now, PCI performed during the same session in additional major coronary or in additional coronary artery bypass graft should be reported using the applicable additional base code. In the same session, if both native and bypass graft PCIs are performed, then you must use both base codes. The PCA performed during the same session in addition to major coronary or in addition to coronary artery bypass graft should be reported using the applicable additional base code, not the add-on code. And the PCA performed during the same session in additional coronary artery branches should be reported using the applicable add-on codes. If the PCA is performed on major coronary artery, then you must use the base code. If it is performed on additional coronary artery branches, then you must use the add-on code. If a single lesion extends from one target vessel, that is major coronary artery or coronary artery bypass graft or coronary artery branch, into another target vessel. If single lesion extends from one target vessel to another target vessel, but can be revascularized with a single intervention, bridging the two vessels. And this PCI should be reported with single code, despite treating more than one vessel. Because here the revascularization is achieved with a single intervention. Though single lesion extends from one target vessel to another target vessel. Here two vessels are getting treated, but the revascularization with a single intervention, bridging the two vessels, can be done. Then only one PCI code should be reported. And that should be reported based upon the ranking of intensity. For example, if a left main coronary lesion extends into proximal left circumflex coronary artery and a single stent is placed to treat the entire lesion, this PCI should be reported as a single vessel stent 92928. In this example, a code for additional vessel treatment 92929 would not be additionally reported. You need not report the add-on code for another vessel. Only one code is sufficient in this example 92928. The next point is, when bifurcation lesions are treated, PCA is reported for both lesions, both vessels. Whenever the bifurcation lesions are treated, PCA is reported for both vessels treated. For example, when a bifurcation lesion involving left anterior descending artery and the first diagonal artery is treated by stunting both vessels. Here stunting is done for both vessels. Then you must report 92928 and 92929, both base code and its add-on code, because here two vessels are treated. And we are treating bifurcation lesions, not a single lesion. Next, target vessel PCI for acute myocardial infarction is inclusive. The target vessel PCI for acute myocardial infarction is inclusive of all balloon angioplasty, atherectomy, stunting, manual aspiration thrombectomy, distal protection, and intracoronary rheolytic agent administration when performed. All these services are included in the target vessel PCI for acute myocardial infarction. Mechanical thrombectomy may be reported separately. Aspirational thrombectomy is included, whereas mechanical thrombectomy, it can be reported separately. Now coming to chronic total occlusion. The chronic total occlusion of a coronary vessel is present when there is no antegrade flow through the true lumen, accompanied by suggestive angiographic and clinical criteria. Example, antegrade bridging collaterals present, calcification at the occlusion site, no current presentation with ST elevation or Q wave acute myocardial infarction. They are attributable to the occluded target lesion. The current presentation with ST elevation or Q wave acute myocardial infarction attributable to the acute targeted vessel. All these things, they are attributable to the occluded target vessel. Whereas subtotal occlusion with dying stain at the site consistent with fresh thrombus are not considered total chronic occlusions. Subtotal occlusion with dye staining at the site consistent with fresh thrombus, it is not considered as total chronic occlusion. Coming to the codes 92923, percutaneous transluminal coronary thrombectomy mechanical. The next code is 92974, coronary brachytherapy. Next is 92978 and 79, intravascular ultrasound optical coherence tomography. Next is 93571 and 572, intravascular Doppler velocity and or pressure fraction flow reserve or coronary flow reserve, and 0715T, percutaneous transluminal coronary lithotripsy. All these things are the add-on codes. These are the add-on codes for reporting procedures performed in addition to coronary and bypass graft diagnostic and interventional services, unless included in the base code. These are all the add-on codes that are used for reporting the procedures performed in addition to the coronary and bypass graft diagnostic and interventional services. Non-mechanical aspirational thrombectomy is not reported with 92973 and it is included in the PCA code for acute myocardial infarction 92941 whenever performed. And to report transcatheter placement of radiation delivery device for coronary intravascular brachytherapy, we must use 92974. And for intravascular radio element application, you need to refer the radiology section 77770, 77771 and 77772. And for non-surgical septal reduction therapy, example alcohol ablation, you need to use 93799. These are some of the guidelines. Now coming to code descriptions. 92920, as we know, it is a base code of percutaneous transluminal coronary angioplasty, single major coronary artery or branch. And for percutaneous transluminal coronary lithotripsy, you need to use 0715T. This is a category 3 code. Next is the add-on code plus 92921. For each additional branch of the major coronary artery, you need to use this add-on code. And this can be used in conjunction with the following base codes. Coming to next CPTs, they are 92924 and 92925. The description of 92924 is percutaneous transluminal coronary atherectomy with coronary angioplasty when performed single major coronary artery or branch. The next is the add-on code plus 92925 for each additional branch or vessel. The next CPT is 92928 and 92929. This is the add-on code for this base CPT. Description is percutaneous transcatheter placement of intracoronary stent with coronary angioplasty when performed single major coronary artery or branch. Next is the add-on code plus 92929 for each additional branch or major coronary artery. Now let us see an example. A 69-year-old female has been having chest tightness. Cardiologist orders percutaneous transluminal coronary angioplasty of the right coronary artery and left anterior descending coronary artery. The procedure reveals atherosclerosis in the native vessel of the left anterior descending coronary artery and right coronary artery. Previously, PTCA was planned, but during the procedure, atherosclerosis was noted. So, stents were inserted in both arteries to keep the arteries open. The patient was placed under moderate conscious sedation during the procedure for a total of 30 minutes. what CPT codes should be reported. So, percutaneous transluminal coronary angioplasty with stenting. The appropriate CPT is 92928. Percutaneous transcatheter placement of intracoronary stent. Stents are placed with coronary angioplasty when performed, single major coronary artery or branch, along with LD modifier to indicate left anterior descending coronary artery, followed by add-on code plus 92929 with RC modifier to indicate right coronary artery. So this is given for each additional branch. One code is given for left anterior descending coronary artery and the other add-on code is given for right coronary artery, because we know that base code should be coded only once. For that reason, we are using an add-on code for additional vessel, though it is a major coronary artery. And then patient was placed under moderate conscious sedation. There are CPTs for moderate conscious sedation also. The first one is 99125. Moderate sedation services provided by the same physician or other qualified healthcare professional for initial 15 minutes of intra-service time. And the patient age must be 5 years or older. Next, here the total time is 30 minutes. So we have first code for initial 15 minutes. After that, add-on code for plus 99125 for each additional 15 minutes intra-service time. The next CPT is 92933. Percutaneous transluminal coronary atherectomy with intracoronary stent with coronary angioplasty when performed. Next is the add-on code plus 92939 for each additional vessel. It can be branch or a major coronary artery. Now let us discuss one more example. Jim underwent a percutaneous transluminal coronary atherectomy with a balloon to the left main coronary artery. During the same session, his physician placed 3 drug-coated stents in the left circumflex artery. So 2 arteries are treated. So you need to use 2 codes. The first one is 92933 with LM modifier to indicate left main coronary artery. 92933 percutaneous transluminal coronary atherectomy with intracoronary stent with coronary angioplasty when performed. Next is add-on code 92934 along with LC modifier. LC indicates left circumflex coronary artery. So these two are the appropriate codes for this example. The next CPT is 92937. Percutaneous transluminal revascularization of or through coronary artery bypass graft. This is the base CPT for bypass graft. Graft can be internal, mammary, free arterial or venous. And any combination of intracoronary stent or atherectomy, angioplasty, including the distal protection when performed single vessel. Below is the add-on code plus 92938, each additional branch subtended by the bypass graft. You must use 92938 in conjunction with 92937. The next CPT is 92941. This is percutaneous transluminal revascularization of acute. It can be total or subtotal occlusion during the acute myocardial infarction. It can be either coronary artery or coronary artery bypass graft, any combination of intracoronary stent, atherectomy and angioplasty, including aspirational thrombectomy when performed single vessel. That is the description of 92941. The next is 92943. This deals with revascularization of chronic total occlusion. The only difference is chronic total occlusion. The next is the add-on code plus 92944. 944 for each additional branch, coronary artery branch or bypass graft, etc. And use 92944 in conjunction with any of the base CPTs. In addition, to report transcatheter placement of radiation delivery device for coronary intravascular brachytherapy, we must use 92974. And for intravascular radio element application, we need to see 77770, 77771 and 77772. The next CPT is an add-on code only, indicated by plus sign. Plus 92973, percutaneous transluminal coronary thrombectomy mechanical. Aspirational thrombectomy is included, whereas separate CPT is there for mechanical thrombectomy. And use 92973 in conjunction with these following CPTs. And do not report 92973 for aspiration thrombectomy. That is important. Next code, plus 92974. Transcatheteral placement of radiation delivery device for subsequent coronary intravascular brachytherapy. This is also an add-on code that must be used in conjunction with these base codes. The next CPT is 92975. Thrombolysis coronary by intracoronary infusion, including the selective coronary angiography. Next is by intravenous infusion. It is the previous one is intracoronary infusion 92975 and 92977 is by intravenous infusion. Next is the add-on code 92978. This is endoluminal imaging of coronary vessel or graft using intravascular ultrasound IVUS or optical coherence tomography OCT during the diagnostic evaluation and or therapeutic intervention, including the imaging supervision, interpretation and report initial vessel. This is an add-on code and must be reported in addition to the primary procedure, and it must be reported only once per session. That is important. Next is for each additional vessel 92979. This is also an add-on code. And report 92979 once per additional vessel. One more important point is intravascular ultrasound and optical coherence tomography services include all transducer manipulations and repositionings within the specific vessel being examined both before and after the therapeutic intervention, that is stent placement. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.